Good morning. Thanks for joining me at Cuddles and Milk and Petaluma today. So today I'm going to start something new. This is called a breastfeeding journey. So what I'd like to do is discuss what might happen in a typical woman's breastfeeding journey, everything from pregnancy to when she weans. So we're going to kind of run through a lot of things. This wouldn't be necessarily a typical person because this fictitious person is going to run through a lot of possible scenarios. So hopefully one person doesn't hit all of these things, but let's start anyways. So today I'm going to talk about the end of pregnancy. So in the third trimester, what can a woman expect in regards to breastfeeding? So the first thing I want to say is it's totally normal to be leaking colostrum. If you are, fantastic. Hand express it in the shower. If you can catch it, great. If you can, save it in little tiny things. And if you can't, no big deal. There is a saying in lactation called move milk to make milk. So if you express some in the shower and you lose it down the drain, no big deal. The more you get out, the more you will make. So that is crucial to your supply. Okay, so we want to get that milk moving. No big deal. You don't catch it, save it, and save it. Just keep it moving, keep it moving. So that's the first thing you could be doing in the end of pregnancy. You might be leaking colostrum. You might not. That's fine. No big deal. Okay, the second thing you should be doing is kind of planning ahead for the hospital days. And that might include taking a breastfeeding class. It might include finding out about any lactation support, but kind of planning ahead, kind of thinking about those first few hospital days. What are you going to do there? What are you going to do the first 2 days home? So really like the first 4 or 5 days of life. What are you going to do? Are you going to have family and friends around during this pandemic? Possibly not. So how are you going to kind of help yourself prepare for this kind of big change in your life? Okay, so thinking about what you can do in the hospital is huge. That's very, very helpful. And also kind of planning ahead and getting some support. Support is very, very important. Right now during this pandemic, a lot of hospitals have closed their outpatient lactation. They have stopped breastfeeding classes. They have stopped any outreach. They have limited everything, which is really unfortunate because during this pandemic, the best thing you can be doing is breastfeeding your baby. That is the number one health protection you can give that child. Okay? Even if you are exposed to COVID, we can talk about that at a future time, but even if you're exposed, there will be antibodies in your breast milk and not the COVID virus itself. So your breast milk will actually make antibodies and protect your child. That is the number one thing. Breast milk is more than food. Breast milk is medicine. Okay. So lining up some support, finding out who are lactation consultants in your area. Do you have anyone doing home or office visits in your area? Are you going to work with someone virtually? What are your options? Okay. Finding someone beforehand. And maybe even finding out if you have insurance coverage beforehand. There's a great, wonderful insurance kind of middleman called the Lactation Network. I work with them and love it. A lot of my clients will go through them. They get 3 visits paid at no cost to the client. And the Lactation Network handles all of the insurance billing and headache. It is a wonderful thing. So finding out about that, kind of planning ahead. If you wind up not needing the resources, everything goes great, sweet. You didn't lose anything, no big deal. But, if you didn't plan and things don't go well, at 2 a.m., you're going to be sitting there with a screaming baby and you're going to feel overwhelmed and you're not going to know who to call. Okay. And you're going to be sleep deprived and you're just going to have a hard time. So having some resources and some support lined up beforehand is huge. Okay, so let's recap. Today in the breastfeeding journey, we were talking about the end of pregnancy, what you can expect to do towards the end. We talked about possibly leaking colostrum, researching our support options, and doing those things, even taking a breastfeeding class. Preparing with a breastfeeding class is so huge. Right? It is so huge to know what is normal and what is not. Because the truth is, how can you know when to ask for help if you don't know what to expect? If you don't know if something is normal or not, then you don't know if it's a problem. So many women think breastfeeding is supposed to be painful. So they go on for weeks and weeks, and I'll have a client call me 3 weeks in saying their nipples are bleeding and it hurts so bad. They don't know the pain isn't normal in breastfeeding. Apparently, people aren't telling them this. Pain is not normal in breastfeeding. But again, if you don't know what's normal, how are you supposed to know when to ask for help? Okay? So, getting those things and getting that information. I want to say hi to Jaja. Thank you for joining in today. It's great to see people coming on. Pass this on to anyone you know who might be expecting or getting ready for a baby or breastfeeding. And if you have any questions, please go to my Facebook page at Cuddles and Milk Petaluma, go to my Instagram, or go to my website at www.cuddlesandmilk.com. I would love to hear comments and questions. Comment on this on Facebook. I would love to hear thoughts. If you have a question you want me to address in a Facebook Live, I would love to do that. Okay. I am also going to start another series soon, called Is It Normal? So we're going to go through all of those things. How are you supposed to know when to ask for help if you don't know what's normal? Okay. So I will have those also coming up soon. So come back and join me at cuddlesandmilk.com or Cuddles and Milk and Petaluma on Facebook and Instagram. Okay, thanks for joining in today. Thanks, Jaja. Nice to see you. Bye. Have a good day, everyone.